Hi everybody. Within the previous videos you got familiar with the blood-brain barrier and you realized that it is responsible for assuring the maximum security related to the brain. You know, the brain is the central controlling part of the body. So we have to make sure that not all the compounds, the toxic compounds and hazardous molecules can enter the brain. So the blood vessels which are within the brain have to be more careful. They shouldn't let all the materials to pass from here to the blood to the brain around it. So this security and this maximum assurance of security is caused by the blood-brain barrier. You know, within the normal blood vessels, the structure is different compared to the blood-brain barrier. Let's have a look at the normal blood vessel. As you see here, within a normal blood vessel, the inner part of the blood vessel is called the endothelium. Okay, it is composed of the endothelial cells. As you see here, they are placed near each other, but there is a sort of a distance between these endothelial cells, which allows the passage of the nutrients and, you know, the oxygen and other drugs and, you know, the things that we introduce within the blood to be able to pass from the endothelium towards the tissues in the periphery of it. Okay, but not everything. However, when it comes to the blood vessels which are within the brain, the endothelial cells which are here, they are acting more carefully. Okay, there are some other things which are helping these endothelial cells to be more careful. And here again you see the structure of the blood vessels within the brain. Well, we mentioned that it is useful, you know, it is an anatomical adaptability to protect the brain. Okay, well, just think about the viruses and the bacteria. They shouldn't be able to pass from here. So what is responsible for the blood-brain barrier? Let's have a look at this picture. Here we want to get familiar with the tight junctions which are related to the security of the blood-brain barrier. As you see here, the capillaries, they are wrapped with some cells to protect the brain all around here, not to pass the compounds and toxic molecules. And here we want to see the detailed structure of the endothelial cells within the blood-brain barrier. You see here, in addition to the endothelial cells around the blood vessels, we also have the pericytes. These are the contractile cells. And we also have the astrocytes. The astrocytes are not responsible for the neural activity of the brain. They are just connecting the neurons to the endothelial cells, and they are acting as sort of a bridge for the communication between these two. However, in this slide, we will get more familiar with the details of the blood-brain barrier. Well, we mentioned that the endothelial cells within the blood-brain barrier are forming a sort of a tight junction. This is the structure of the tight junction, which doesn't let the passage of, you know, the toxic molecules and many types of drugs that we mentioned. But it lets the passage of alcohol, it lets the passage of heroines and other types of drugs. Well, you see here the occluding proteins, the Claudin proteins, and the cadherin proteins. Within the normal blood vessels, as we mentioned, we only have these types of proteins, the cadherin proteins, which form the inner layer of the blood vessels. But when it comes to the blood-brain barrier, in addition to these cadherins, we also have the claudins and the occludins. You see here that the tight order and the structure of these two types of proteins all around here, they form a sort of a gate, really protective gates. They do not let the passage. So this forms the tight junction, as you see here, okay? When the molecule wants to enter, they are faced with these gates. They cannot pass. They cannot pass again. Here, the occludins are here, and then the cadherins. So what should we do? What does these molecules do? What is exactly changed when these two types of proteins are present? Well, you know, within the normal blood vessels, where only the cadherin is present, the cellular membrane is somehow in a fluid phase, you know, a liquid phase, let's say. So when the molecules are absorbed on the layer of the endothelial cells, they can move all around here and find a way to finally diffuse and pass the endothelium, okay? But here, because these two proteins are harshly present, they are present like the big man, okay? Like the black-skinned bodyguards. When you want to enter the parties, you know, there are the black-skinned bodyguards all around here, and they do not let you to move, okay? So the presence of these two proteins makes the outer shell of the cellular membranes to be more rigid, to be more solid-like. So the materials which are absorbed here, they cannot move all around here, and they cannot find a way to diffuse and to pass from the endothelium towards the brain. And that's the good thing. But when we want to deliver the drugs, we are definitely faced with difficulties, with limitations. So we have to find a way.